Good afternoon, everyone, and thank you so much for joining us for this important announcement regarding mental wellness in the communities served by Heart of Florida United Way. We appreciate you all braving the rain. What a storm to get in here, so thank you for being here. I'm Nancy Alvarez, VP of Community Relations and Equity Impact for Heart of Florida United Way. We want to thank Mayor Demings and his team, first of all, for hosting us here today for this news conference, and mostly, though, for their trust in us to take a leading role in how our community heals from a mental health standpoint after the last 2 years of this pandemic. 2 years ago this week, let's go back. Does everybody remember? Students in our local schools were looking forward to spring break. Many families had trips planned or camps booked for their kids to spend the week if their parents had to work, because 2 years ago this week, most parents did not work from home. Remember that? We were all in our offices. Those kids never went back to school after spring break. Many didn't return for a year or more. We know this impacted the mental health of our children. This impacted the mental health of all of us. The families we serve, who already live paycheck to paycheck, faced even greater fears and obstacles when the wave of furloughs began, when loved ones got sick, and in many cases, passed away. With us today are leaders from nonprofit organizations in our community who were front and center in meeting the needs of our community during this time of high stress, uncertainty, and for many, deep, deep sorrow. So it's my honor, really, to introduce to you today the group of people here. Jennifer Cook is the general manager of our local PBS affiliate, WUCF-TV, a nonprofit that worked tirelessly to keep our community informed. Denise Lamas is Executive Director of Hispanic Family Counseling, who can speak to you today about the many, many barriers that many families face when it came to language in our community during the pandemic. Dr. Lauren Josephs with Visionary Vanguard Group is our lead researcher of our mental health report and can give you really an overall picture of some of the obstacles that we're facing in our community. And my friend, George Wallace from the Center, the Executive Director, and he is here obviously representing a very important and special part of our community here in Central Florida. So thank you all for being here today with us. So as you may know, our organization runs the 211 call crisis hotline for Orange, Seminole, and Osceola counties. Please listen closely to these numbers. Since the start of the pandemic, our 211 specialists handled over 10,000 suicide calls, 10,000. Last year, they received an average of 20 suicide calls per day from Central Floridians at a breaking point. Suicide call will come in while we're here talking. At Heart of Florida United Way, our job is to be there 24/7 to pick up the phone and connect those callers with the services they need, but it has become apparent to us that we need to do more. So with details on our announcement and the gift that is making all of this possible, it's my honor to introduce to you the President and CEO of Heart of Florida United Way, Jeff Hayward. Yes.
Jeez. Good afternoon. Thank you, Nancy, very much. And I want to echo what Nancy said about the leadership that the mayor has provided. Orange County did a remarkable job in a study not too long ago led by Donna Weitsch and her team. And there are, given the need in the community, there are very few leaders who are willing to step up and take on this issue. And the fact that Mayor Demings stepped up really in a big way with the Board of County Commissioners is remarkable. And I would challenge you to look across the rest of the state or the rest of the country. While it's one of the most important issues facing us nowadays, particularly after the pandemic, there are few who are leading the way like Mayor Demings is. So thank you, Mayor, for that leadership. As Nancy described, there's no shortage of need in Central Florida. Many of us felt it. We felt it in our own families. We felt it amongst our teams and amongst our friends. Mackenzie Scott, who is an author and philanthropist, knew that too. And she has been donating, as you know, a great deal of money throughout the country and nonprofits and trying to build up their capacity. And she gave to nonprofits when we needed it most. During times like this with the pandemic, during recessions and so forth, you'll see the demand for services spike, but you'll see the resources available drop. And that puts us in a precarious position as we try and listen and answer the call from the community. Heart of Florida United Way from Mackenzie Scott received a historic $20 million gift. It was given to us unrestricted, general operating support. And there's a quote that she wrote during the time that she was giving these dollars away. And message to the nonprofits, she said, "You've all been working hard. The pandemic exacerbated that. I want you to take this money, hire some staff, buy them a chair, and get some sleep." Because she knew that nonprofits often have hand-me-downs, shoestring budgets, and particularly during the pandemic, we were all overworked, as many other people were, but she recognized that in the nonprofit world. What this gift did is it allowed us to think differently in the community. It allowed us to look beyond our usual partners. It allowed us to tackle issues that we never thought we would have the resources to do. And for that, we're forever grateful to Mackenzie Scott. From the research we did in trying to think more strategically and figuring out where can we really make a mark, we looked at 4 key areas that rose to the top. One was pathways to financial prosperity for our families, strong starts, including early education, homes for the heart of Florida, and healthy minds for healthy lives. As Nancy said, that's what the deep issue has been over the past 2 years. One core principle remains, and that is essentially our tagline is that to live better, we must live united. And that's why we're very proud of the partnership we have here at the county in doing this study led by Dr. Josephs. But now the hard work starts, and that's the implementation of it. Just 15 days ago, we were in this very same room talking about these issues and presenting the report, building again off what Donna had done and then what Dr. Josephs had built upon that. So today, we are very proud to announce that one of our first investments from the Mackenzie Scott money is in the area of healthy minds for healthy lives. And we are committing to the county, as one of the recommendations in the report is a public awareness campaign. And we are proud to commit today $1 million towards that public awareness campaign.
I think that's worth it.
And again, Mayor Deming's leading the charge in the study. One of the recommendations came out of that was a public awareness campaign. And you're going to hear more about why the public awareness campaign. But there is so much stigma attached to mental health, asking for help. Where do I go to get help? And even if you have insurance, which we found from this report, many people have. But there's still that hesitation to ask for help because it may have some unintended consequences. You may lose your job. People may look at you differently. And what this public awareness campaign will do, it will be culturally and linguistically competent and sensitive to the entire community, but it will hopefully reduce that stigma that it's okay to say, I'm not okay. And there's always been that hesitation for many, many people. As Nancy said, we have handled far too many suicide calls in our 211 call center this past year. Just in the time that the Board of County Commissioners voted on this contract to ask us to complete the study with Dr. Josephs, to the time we actually presented it, there were over 1,100 suicide calls into our office just in Orange County. Not our 3-county footprint, just in Orange County in those few months, 1,100 people picked up the phone, dialed 211, and it came in as a suicide call through our suicide hotline. This is a pervasive problem in our community, and we need to tackle this, but we also wonder how many people didn't call, how many people did not pick up the phone because of that stigma. We all face it. I don't know about you, but I'm not ashamed to admit that during these pandemic times, we all felt down, we all felt depressed, we were struggling, and I'm not immune to it too. There were times during the last 2 years in trying to run an organization from home, worrying about your own team and them getting sick, and worst of all, if they were to contract COVID, would they survive it? Trying to answer the call from the community, trying to worry about my own children and my wife. I'm not immune to it either. And again, I'm not ashamed to say that during those 2 years, there were a couple of months there that it was very, very difficult. And I'll bet there are a lot of other people who felt that. And I just wish more people were able to come forward and seek the help that they need. We're going to build this on what is a best practice, a SAMHSA model. We'll be talking about reducing stigma throughout the community, getting the message out, as I said, in multiple languages, and trying to reduce that stigma. We'll also be introducing, during the time now moving forward, a Train the Trainer program. As Dr. Josephs found out in her study, not everyone needs a therapist, but everybody or many people at least need to talk to someone. And then the question is, as a friend, as a colleague, as a family member, how do you listen appropriately? How do you hear what you're supposed to hear and then give advice with some confidence? So we will be introducing, again, while the mayor and Orange County and the private sector and the nonprofit sector work to build and enhance our mental health system, what do we do in the meantime? What are hopefully some quick fixes, some assistance along the way? And we do think that a Train the Trainer program that we will introduce here, again, with the help of the mayor and some healthcare facilities around the county, will be able to deliver those services to the community. We'll introduce them to workplaces. We'll introduce them to social groups. We'll introduce them to neighborhood groups, whoever is willing to step up and be trained and then work amongst their colleagues throughout that area. So we are very proud to do that. We're looking forward to now continuing the implementation of this program and the recommendations coming out of the report in whichever way Heart of Florida can do that, in whichever way we can bring additional partners to the table to, again, assist the mayor and the Board of County Commissioners in implementing the report. And with that, I want to introduce Mayor Demings.
Let me just start by first saying thank you to Jeff Hayward and the entire United Way organization for the work that they are doing here in this community as an umbrella nonprofit entity that serves many of the other nonprofits in our community. I want to say congratulations to Nancy Alvarez for her relatively new position here within our community. She's normally the one doing the interviewing and sitting behind a desk as an anchor. So we're glad to have her in this community as well. Thank you to the Heart of Florida United Way for the $1 million commitment to improving mental and behavioral health in our community. We believe that $1 million will be well spent to make certain that our community is well aware of the resources that we will be bringing together. When I listen to Jeff and Nancy talk about the numbers, when you think about 10,000 calls, 1,100 families since we commissioned this study, those numbers are more than just numbers. It represents lives. It represents families. And when you think about the thousands of families that are being impacted, and those are just the ones that we know about, when you think about the other family members who may be impacted by an individual who is struggling with some mental health issues, it is significant. And as a community, as a lifelong resident of this community, it is very humbling to know that our community is coming together to address these issues. So how do we fill the void, the gap? We know that we have at least a $49.7 million gap in services here in this community that was identified by the study and the evaluation that was done by Dr. Joseph and her organization. And that's just probably the tip of the iceberg. But in the interim, we have this moral responsibility to make certain that we are providing the treatment, the resources in the interim. And so Orange County will continue with this commitment through its various resources, and I wanted to just share with you some of the things that is currently underway. Since the pandemic began, Orange County has expended approximately $12.4 million from Federal CARES Act funding directly in regards to mental health and behavioral health treatment and other related services. In addition, we have provided approximately $10 million in American Rescue Plan Act funds, which have been allocated at this point for mental health and homeless services. So we still have those dollars that we will expend within our community. That figure really does not include monies obtained from the state and other federal grants, nor the general revenue dollars that we allocate as the Orange County government on an annual basis. We know that we need to do more, and we're in the midst of the execution of the plan using our technical experts, our clinicians, the people who are in the field who actually work in this space. It is a laborious process, and I know that those who provide the mental health services, much like those who have been providing the health care services in our community for the last 2 years in particular, it has been tough on those people. I know because I talk to many of them. They share their experience with me. And so we do owe it to them to adequately fund this, and I know that when we look to our private sector and other nonprofits and other governmental partners, that we will come up with a better solution than what we have today. On Tuesday alone, the Board of County Commissioners voted to invest $500,000 of American Rescue Plan monies to increase mental health and other health services for residents experiencing homelessness or at risk of homelessness. This program is new to our community at the Pathways Drop-In Center, which will provide an array of mental health and substance abuse services, including telehealth and licensed mental health professionals, case management, addiction specialists, and peer support staff. We're excited at the prospects of improving our mental and behavioral health system of care. We look forward to working with our business community, again, the nonprofits, the philanthropic community, and other community stakeholders as we endeavor to do better in our community. I've said that this is an issue that together we should own as a community, to take care of those who are suffering. And I know it is somewhat surreal. Here we are, nearly 2 years to the day. It is surreal what we have all lived through, but real at the same time. We have been in the hospitals. We have been to the funerals. We have seen our family members, our coworkers, our friends, and others who've been impacted by COVID-19 in a community that already has some issues like every community around America. But there's no question that this is a step in the right direction for our community. So from the bottom of my heart to all of these clinicians here, let me just say thank you for the work that you're doing in our community. I'm going to turn it back over to, I believe, Nancy at this time.
Thank you, Mayor Demings. And just a few additional announcements before we close that are centered on how we reach families. I just want to say that we're really going to be relying on you, on the media, to follow us as we implement these plans we just announced and inform the community along the way. It's very important that we all participate in this, and the messaging is so important. We want to let you know that we will have the mental health report available in both Spanish and Creole. And Heart of Florida United Way has also partnered with WUCF-TV to air a special called COVID, 2 years later, From Chaos to Resiliency. And it's a really deep look into how different groups were impacted by the pandemic. And we have a mental health expert who weighs in and talks about the impacts to our children, our senior population, and our workforce. And he talks about where we go from here with those groups. The air dates will be in a press release from WUCF-TV, and it's the first of what we hope are more collaborations between our nonprofits, because maintaining an open, authentic conversation with no judgment about mental health is essential to healing our community. So thank you so much today in covering our efforts, and thanks to you guys for being here as well. Thank you, Mayor. Wraps up everything.